Welcome, everyone. My name is Sarah Ray from the Bloomfield Public Library. Thank you for joining us tonight for Holistic Skin Solutions with Dr. Neffinger. I'm going to turn it over to you now.
Hi, everyone. Thank you, Sarah. I'm Dr. Neffinger. Thank you for having me today. I'm a naturopathic doctor. I practice in West Hartford, Connecticut at Bloom Natural Health, and I have a concentration specialty interest in dermatology and acne treatment. And I'm here today to talk to you about how you can manage your skin health naturally, so holistic skin solutions. I'm going to go through a little presentation that I put together, and then you can ask questions in the chat, and I'll take questions at the end. So typically I'll start by talking about different skin types. So there's a lot of different skin types, and I'm sure all the people here today have multiple different skin types, but normal is basically a type of skin where you can do anything to it. Stays pretty solid throughout anything. You can use any product. You won't react very strongly. You don't get much acne or other conditions. Dry skin tends to be flakier. Oily skin tends to be oily and usually tends to be acne prone, but not necessarily. Combination skin typically is normal or dry in certain areas and oily in other areas. Sensitive skin, if you have sensitive skin, you know it because you react to things really easily. You get dry, red, you get breakouts. Sometimes certain skin conditions like rosacea can fall under that. And then aging skin. And really, I encourage all of my patients to think about aging, even if they're in their teens. It's time to start protecting that skin. So we'll talk about some of that today. And if I don't cover anything about aging that anyone's interested in, please feel free to write it in the chat. And then there's also dermatologic conditions, rosacea, keratosis pilaris, polycystic ovarian syndrome is a type of female condition that can lead to acne, and then acne itself. So there's a lot of different skin medical conditions on top of the skin types. So I really have a personal interest in skincare. I love learning about skincare, trying out skincare, watching videos about skincare. And majority of people I've learned just really need a simple skincare routine. You don't need a million products to make your skin look good. You just need to be doing the basics. And then anything on top of that your skin tends to react well to is extra if you want. So cleansing is really important. We'll get to that, but moisturizing and sun protection are really your three most important skincare products. If you're not using all three of those, it's a good idea to start incorporating them. Give a new routine or product at least 4 weeks to work and be patient because you might see a lot of changes in your skin in the time that you introduce a new skincare routine. So you might see dryness, oiliness, acne, different things like that. And really you should be waiting at least 4 weeks. Unless you have a really severe reaction, then I would stop a product. And in general, ingredients that you should be avoiding, you can look at the ingredient list on different products. Sulfates, though it's a type of cleanser, it's really stripping to the skin. Alcohol, again, really drying, heavy fragrances, typically not just unnecessary and not very healthy for the skin. If it's a wash-off product, like a cleanser, fragrances aren't that big of a deal because they're not sitting on your skin, but otherwise I would say they're just something that's not necessary. And if anything, they tend to be aggravating for people. And parabens, another chemical that we probably should be avoiding in any product that we use. Some brands that I typically recommend are Naturopathica, Environs, First Aid Beauty, Drunk Elephant, Beauty Counter, Pharmacy. You can find any of those on the internet. Sometimes boutiques sell them around West Hartford or other areas like Bloomfield. I'm sure you can find them. Blue Mercury sends a lot, and Sephora sell a lot of those products. Cleansing. So I'm going to go step by step here. So Cleansing a really important part of your skincare routine, because especially at night, if you're removing any pollutants or chemicals or dirt that your skin has been exposed to during the day, it's important to cleanse at the end of the day. It's important to cleanse after a workout. But I'd say an evening cleanse is really the most important cleanse. If someone has really dry skin, then I might recommend that they skip their morning cleanse, because over cleansing can strip your skin of healthy bacteria. You have a microbiome on your face. So you have colonies of healthy bacteria on your face and skin, just like you do in your gut. And they're really important for keeping the bad bacteria at bay and making sure that everything's working correctly. So if you over cleanse, then you might be kind of removing those healthy bacteria and drying out your skin. So for the average person, I usually recommend cleansing in the morning, evening, and after sweating. And cleansers are they really vary. So you can get hydrating cleansers. You can get cleansers that are more foaming, and those tend to be for oilier skin. And make sure that you're not over exfoliating. So there's a lot of exfoliating cleansers out there that typically can be harsh on the skin. So for example, there's a very popular brand out there that has an apricot scrub. I don't recommend using something like that. The exfoliants in there aren't very uniform. They can really be stripping and drying to the skin. So I would go for gentle chemical exfoliants, which we'll kind of talk about more later on in this lecture. And then don't be exfoliating too often. And then one thing that people use a lot of are makeup removing or cleansing towelettes. And those are really bad for your skin. Just throw them in the trash and don't. They're just smushing things around. They're full of chemicals. They're bad for the environment. I would just take them out of your skincare routine. If you wear makeup during the day and you want a really good option for removing it, micellar water, micellar, is a good option. You can put it on a cotton pad or a reusable cotton pad and kind of wipe off your makeup. Or you can use an oil-based cleansing balm, and that basically will actually just kind of melt off your makeup, and then you wash it off and then you use your regular cleanser after that. Sunscreen photo protection. So this is really the most important step that you can take in your skin if you're worried about aging. Basically, the best sunscreen is the sunscreen that you'll actually use. That's what I tell all my patients. So there's a lot of sunscreens out there. I'm going to talk about mineral versus chemical, but again, the best one is the one you'll actually use. So find a sunscreen that you like, stick with it, dabble around a bit. But if you're not liking a mineral sunscreen versus chemical, then just go for a mineral one, or sorry, just go for a chemical one. Cancer prevention, sunscreen is very important for it too. Obviously, more and more research is coming out about skin cancer and sun protection, and it's very important. I consider it a non-negotiable part of your skincare routine, especially if you have anything like eczema or rosacea, lupus, you absolutely must be using a sunscreen. Now, mineral sunscreens versus chemical sunscreens. So mineral sunscreens tend to be made out of ingredients that are actually physically blocking out the sun. So something like zinc oxide, which is a very thick mineral layer on your skin. It's going to be a physical block, versus a chemical sunscreen actually makes chemical changes so that your skin deflects the sun rays. So they're made of different ingredients. Mineral sunscreens tend to be thicker. They tend to have a little bit more of a white, what we call a white cast to them. So anyone with more melanin in their skin, basically what I would recommend is there are, mineral sunscreens that are more friendly for darker skins, or you can add like a bronzer into it. I use the D-Bronzy drops by Drunk Elephant, and you just kind of add them in and it kind of adds like a nice little sheen to the sunscreen. You can put it on your face. Chemical sunscreens tend to be lighter. They absorb a little bit easier, typically a little bit better for very acne prone skin. But I did write 3 options here that I think are better for acne prone skin. So they're a little bit lighter and they absorb a little better. If you're looking, the first 2 are mineral sunscreens. The third one is a chemical sunscreen. CeraVe, it's a pretty basic line of skincare you can get at the drugstore, and it's tolerated by most skin types. And then certain nutrients that help protect your skin are antioxidants, vitamin C, and omega-3 fatty acids. So antioxidants are protective chemicals that you can find in blueberries, grapes, pomegranate, things like that. Really good for cancer prevention. Vitamin C, everyone knows vitamin C, but you can take it in a supplement or you can get it in your foods. Any citrus fruit has vitamin C. A lot of vegetables and berries have vitamin C as well. And omega-3 fatty acids are a really great anti-inflammatory fatty acid that you can find in fatty fish and nuts and seeds and some plant products. But mainly fatty fish is the best source of them. And that's really, really great for skin protection and skin healing. So when you're looking at skincare, there's a lot of active ingredients that are in there that you might find. And you might say, what are all these ingredients? How do I use them? What do they mean? How do I use them together? And it's really a dermatologist or an esthetician or someone who's interested and trained in skincare like myself should be able to walk you through what is appropriate for your skin type and what you can use together and how to build a skincare routine. But if you're someone who's using a really basic skincare routine of a cleanser, moisturizer, and sunscreen, you should be able to add in any one of these ingredients and try them out if you want to. So a retinol is a vitamin A derivative. So basically, it's really good for helping your skin kind of like turn over the skin cells faster. So you almost are exfoliating the skin or causing it to build new skin more quickly. And that is really good for acne typically, and then also really great for aging. So I'd say if I had to choose one, that's probably the best option for aging, anti-aging. You can find them in retinol or retinoids. You can find them over the counter at any drugstore or most beauty stores. For those, I would say, don't want to mix them with another active ingredient, and you need to work up to them slowly. So make sure you're doing it like every 2 days, every other day, then every day if you're tolerating it well, because it can cause sensitivity or increased acne at first. Like I said, you want to give this new skincare routine about 4 weeks to start working appropriately. Vitamin C, really good for protecting the skin. Hyperpigmentation, scarring, anything like that. It's really great to help smooth out your skin and create like a more even skin tone and texture. Glycolic acid, salicylic acid are both exfoliants. So they're chemical exfoliants. Salicylic acid is a very popular anti-acne ingredient. Most people are probably familiar with it. And it works by gently exfoliating the skin. Benzoyl peroxide is a very commonly prescribed ingredient to fight acne. Hyaluronic acid is a moisturizing ingredient. So it actually works by drawing moisture out of the air and bringing it into your skin. It's better to be used in more humid conditions. I wouldn't recommend someone in Arizona necessarily getting this and using it because, like I said, it's drawing out moisture. So ceramides are ingredients that are almost similar to your skin makeup. So it kind of helps to reprotonate the skin in a way. Probiotics, like I said, that's helping to replenish that healthy skin microbiome. So the healthy bacteria in your skin. And that's more of a new skin ingredient, I would say. There's not that many probiotic skincare options out there. I think there needs to be more research, but I don't see a downside right now to using a probiotic skincare if it's working for you. So I'm going to touch on acne a bit because I usually get a lot of questions about acne. So acne is basically an inflammatory process where hair follicles in your skin become clogged with oil, dead skin, leading to inflammation, infection, and maybe even scarring. It's the most common skin condition, usually more common in males and in puberty. Things that can make acne worse, and one reason you might want to see a doctor about acne, is hormonal imbalances, clogged and infected hair follicles. So for example, if you're shaving or if your skin's not exfoliating appropriately, poor nutrition. There's a lot of different nutrients that are really important for your skin. If you're not getting them in your foods, then your skin's going to suffer. Blood sugar imbalances, for example, diabetes or polycystic ovarian syndrome, can lead to blood sugar imbalances that may affect your skin. And then popping pimples makes your skin worse too. It's so hard to avoid popping pimples, but everyone knows that you shouldn't be doing that. Fungal acne is something that's actually becoming more and more learned about too. So it's caused by a type of pathogen called Malassezia folliculitis. And it kind of looks like regular acne, but it's a type of yeast on your skin that can proliferate and it can cause little pimple-like structures. So they're usually small, uniform in size. You can't squeeze pus out of them, and they're usually itchy. So if you have acne that sounds like that, good idea to see a dermatologist. Maskne is another one that tends to be an issue right now, or at least in the last 3 years. One way to help mitigate this is using reusable cotton masks that you wash often with gentle detergent or soap. I would use a new mask every day. The cotton masks are not as good at protection as a regular surgical mask or K95 type mask, but you can put a cotton mask on and then put another mask on top of it if you still wear a mask in public. And that can be a little more gentle on your skin. And then avoid wearing heavy makeup under your mask. You know, if you're going out with a mask, you don't really need makeup anyway, and no one needs makeup anyway. It's all up to you if you want it or not, but just something to consider that the mask might be pushing makeup into your face. So nutrition for your skin, the most important thing I would say is drinking plenty of water. If you attended my lecture last month, you know that I push water there too. Make sure that you're drinking a lot of water every day. Most people aren't drinking enough. So you should be aiming for about half your body weight in ounces per day. So if you weigh 120 pounds, you should be aiming for about 60 ounces. If you weigh 200 pounds, you should be aiming for about 100 ounces a day. And I know it's a lot of water. You'll urinate at first much more frequently, but you'll get used to it. And I'd say that's really, really important for anti-aging as well. Focus on, in your diet, healthy fats, really important for skin healing and skin health. So nuts, seeds, fish, avocado. The best fish for your skin are the ones that are really fatty. So salmon, mackerel, anchovies, sardines, those are all really great options. I'd say anchovies and sardines tend to be a little lower in mercury. Salmon's a lower mercury fish, but typically fish nowadays has a good amount of mercury or microplastics. So I'd say stick to about a serving a week. And if you're not getting enough omega-3s, you can talk to your doctor about supplementing with an omega-3 fish oil. Fruits and veggies, super important. Make sure you're eating the rainbow to get all of those healthy nutrients that you need. It's a little easier in the summertime to eat a lot of fruits and veggies, but try to do it all year long. Legumes like beans, lentils, whole grains, try to avoid processed grains and processed foods in general. And if you eat meat, make sure you're trying to buy meat that's raised without hormones. food to avoid for healthy skin and anti-aging and acne and anything. So dairy, sugar, big ones, I'd say. Those tend to be the most common aggravators for skin conditions in my experience. Alcohol, actually, I didn't put on this list, but that's a big one too. Refined carbohydrates, poor quality meats, vegetable oils. So, especially the highly refined vegetable oils, corn, sunflower, safflower, soy, grapeseed, cottonseed, vegetable oil, canola oil. Those tend to be more inflammatory. Extra virgin olive oil is a really good option. And if you're cooking at high heats, I usually recommend avocado oil. It's really easy to find avocado spray oils. Replace your pan with something like that. It's going to make a difference in your health. Really great for your cholesterol too. Gluten, I put a question mark after this one because I don't necessarily recommend that everyone removes gluten from their diet. That's just kind of my personal medical opinion, but I think a lot of people can process gluten just fine, but for some people it does tend to be aggravating. If you're suspecting that you have a gluten intolerance, it doesn't hurt to cut it out for 6 weeks and then reintroduce it and see what happens. Supplements that are good for skin. Make sure that you always talk to your doctor before starting a supplement routine, but I'd say fish oil. I know I talked about that a lot. Probiotics, because your skin health is really dependent upon the microbiome in your gut. So healthy gut means healthy skin. Vitamins A, B, D, zinc, selenium. There's certain herbs you can use that will help to clarify your skin, like milk thistle, burdock, things like that. And then antioxidants like vitamin E, vitamin C, and certain different nutrients are really good for your skin too. Like I said, make sure that you're talking to your doctor before you start a skincare supplement regimen. So lifestyle tips for skin health. Exercise is a really big one. Sweating, even though we want to rinse after we exercise, sweating is a really great way to help remove things that your body doesn't want in it. So sweating helps to cleanse your skin and detoxify your body. Weight loss, if applicable, helps your body to detox excess estrogen and excess hormones that can be affecting your skin health. Make sure that you're cleansing after exercising, and then wash any clothing that you wore to exercise or sweat in. And hats are something people forget about a lot, but they're kind of covering half your face. They're constantly pushing on your skin. They can cause acne. And then that dirt can affect your aging skin too. So washing clothing and hats regularly. I usually recommend, if you have acne or dermatologic conditions, changing pillowcases every 2 to 3 nights and washing in gentle detergent. It's annoying, but it's worth it. All of the chemicals, and if you use hair products, things like that, they're all kind of pressing into your face through your pillowcase. So changing your pillowcase regularly can make a difference. Stress is a major component for healthy skin, whether you have acne or you're worried about anti-aging. Stress is a big one. So I always recommend seeing a therapist if needed, trying to say no more in your day-to-day life, mindful breathing, meditation, things like that can all be really good. Acupuncture is also a great option for stress control. Sleep, make sure you're sleeping well and enough. Keeping your phone clean, that's a big one because we touch it all the time. It touches our face, it pulls on our face. So I typically will just use a little bit of rubbing alcohol and clean my phone every so often, probably not enough, but keeping your phone clean is a good idea. And then avoid touching your face as much as possible. If you have acne, touching your face can really aggravate it because you're adding bacteria to your face. Your hands are full of bacteria. And then also, if you're worried about aging or other conditions, like pulling your skin or leaning on it, just not a good idea. So I'm a naturopathic doctor, so I'm obviously going to promote naturopathic medicine, but dermatologists, estheticians, regular doctors can all do a lot to help with acne or aging skin or any skin conditions, really. I said acne here, but can be used for any skin condition. So lab tests, really basic first step. So making sure that you don't have any hormonal or blood sugar imbalances or nutrient deficiencies that could be contributing towards your acne. Adjusting your skincare routine for your skin type and preference, prescribing supplements if necessary. Individualized nutrition is really important. So taking a look at your diet, what you're eating, seeing what you're missing or what could be improved or what could be removed. Those are all different things. I know last month when I was here, we talked about elimination diets. Elimination diets are a really great option for your skin too. If you have any sort of skin condition, if you have acne, if you're just looking for like your best health, elimination diet is a great option because you can see what foods might be aggravating you. So how I usually do an elimination diet is I'll remove most common aggravating foods or foods that the patient might think is aggravating them, or foods that we test on a sensitivity test for about 6 weeks very strictly, and then reintroduce them one by one, 3 to 4 days apart. And sometimes during that 6-week elimination, I will also do some gut healing during that time. Address any barriers to health like stress or poor sleep. And also sometimes I'll tell my patients when it's time to see a dermatologist. They'll come to me, they'll say, hey, I have this and this and this going on. And they'll say, I can take you this far, but you should probably see a dermatologist. And that does happen. Okay, that's it. So thanks, Sarah.